Imagine a traffic jam, right? Like a really severe one.
Oh, like total gridlock.
Exactly, complete gridlock, to the point where an entire section of a bustling city literally starves, shuts down, and just dies.
Right.
Now imagine that city is actually your heart.
Yeah, that's a terrifying image, honestly.
It is. And when you brought these pathology notes and this historical research to us, what stood out to me immediately was how the most complex, catastrophic failures of the human body can essentially be traced back to just 3 ancient Greek fragments.
Just 3 tiny words.
Right. So today, we are taking a deep dive into the source material you provided to decode these 3 specific medical roots. We're looking at necro, sclero, and steno.
Which translate to death, hardening, and narrowing.
Okay, let's unpack this. Because when you strip away all that, intimidating clinical jargon, these aren't just vocabulary words you'd hear on a hospital show.
No, not at all.
They're literally the 3 primary mechanical ways our bodies break down.
What's fascinating here is that these 3 mechanisms, they're almost always treated as totally separate chapters in a biology textbook.
Oh, definitely. Like they have nothing to do with each other.
Right. But in reality, they are intimately connected. Cardiovascular disease is still the leading cause of death worldwide, and when you look closely at the actual mechanics of it, a heart attack is essentially a deadly, totally predictable chain reaction of these exact 3 words.
Wow.
Yeah. We are talking about the fundamental mechanics of human mortality here.
I really want to get into that chain reaction. But looking through your notes, it seems like before we can understand how these diseases trigger one another, we kind of have to, we have to isolate what each root actually describes physically inside your body.
That makes sense. You need the building blocks first.
Right. So let's start with the most dramatic one, which is necro.
Yeah, necro. It comes from the ancient Greek word nekros, which it simply translates to corpse or dead body.
Which sounds pretty final.
It does, but in clinical pathology, it actually has a highly specific meaning. It signals the localized death of cells or tissue, but, and this is key, while the rest of the organism, the patient, is still very much alive.
Okay, so it's like having a dead room in an otherwise functioning house.
That's a great way to look at it.
Like the plumbing in the rest of the house might be working totally fine, the lights are on, but this one specific room has completely collapsed. The roof caved in and it's starting to rot.
Exactly.
And suddenly your body's immune system has to act as this, like, biohazard cleanup crew before the structural damage spreads out into the hallway.
That is a highly accurate way to visualize the cellular reality of it, because the dead tissue, it doesn't just sit there peacefully.
Right, it's not just inert.
No, it becomes a profoundly toxic inflammatory presence. The dying cells essentially burst open.
Oh, wow.
Yeah, they burst and spill all their internal contents, which actually damages the neighboring healthy cells.
That sounds like a mess.
It is a total mess. And this brings up a massive misconception that we really need to clear up based on the material.
Okay, what is it?
When a doctor says tissue is necrotic, it absolutely does not mean the patient is beyond saving.
Because like we said, the patient is alive, the house is still standing.
Precisely. A person can survive extensive necrosis. Think of a gangrenous toe from severe frostbite.
Ugh, right.
Or a necrotic gallbladder that's lost its blood supply. As long as that dead room is sealed off or physically removed through a surgical process like debridement or even an amputation, the infection is stopped.
So the necrosis is a pathological process happening inside you.
Right. It is a localized disaster, not a synonym for your total demise.
Okay, so if necrosis is the final catastrophic failure of the tissue, what's happening in the days or months or even years leading up to it? Because the body doesn't usually just let a room collapse overnight without a fight, right?
No, it definitely tries to fight back.
It tries to protect itself, often by reinforcing or stiffening the damaged area, which I think brings us to the second root in our deep dive, sclero.
Sclero, yeah. It comes from scleros, which means hard or dry.
Okay.
In this scenario, the tissue is very much alive, but it has gone abnormally stiff.
Like it loses its bounce.
Exactly. Normally, soft, elastic, or pliable structures in your body are replaced by excess fibrous connective tissue. You get heavy, scar-like collagen deposits, or even calcification, where it's literally turning to bone.
So the tissue just loses all its flexibility.
Yeah, it becomes totally rigid.
Okay, I have to push back on this one a little bit.
Go for it.
Because reading through the pathology sources you brought, from a purely logical standpoint, grouping diseases together just because they make tissue hard seems like a terrible way to categorize things.
You are not wrong.
It feels like, I don't know, Organizing a massive library purely by the color of the book covers
Yeah.
instead of what the books are actually about.
That is brilliant, and many critics within modern medicine entirely agree with that exact assessment.
Really? So it's a known flaw.
Oh, absolutely. It is a categorization based entirely on superficial visual appearance, right? Not the underlying biological mechanism.
Which has to be confusing.
It causes profound confusion, even for medical students. Take two highly famous diseases, multiple sclerosis and atherosclerosis.
Okay, yeah, they share the exact same root. They sound like they should be cousins.
But they share absolutely no mechanism. None.
Wow.
Multiple sclerosis is a neurodegenerative autoimmune disease. Atherosclerosis is driven by lipid and cholesterol buildup in the arteries.
So they are completely different biological disasters.
Completely different. The only reason they share that sclerosis root is that if an anatomist were to look at the affected tissue on an autopsy table,
They both just physically feel hard.
exactly, they both feel abnormally firm to the touch. Grouping them together implies a common cause where absolutely none exists.
Wait, let me just make sure I have the mechanism for multiple sclerosis straight so we can really see how different it is.
Sure, go ahead.
So if we think of a human nerve, like a long electrical wire, there is a protective fatty coating around it called myelin, right?
Yes, the myelin sheet.
And it acts like the rubber insulation on a power cable.
Perfect analogy.
But in multiple sclerosis, the body's own immune system gets confused and attacks that rubber insulation, stripping it away.
Strips it right off.
And then, to try and patch the damage, the body lays down this dense, hard scar tissue, which is the sclerosis.
Yep.
And that hard scar tissue is what causes the nerve signals to short circuit, leading to the paralysis and motor issues.
That is the exact mechanism. Now, you contrast that with atherosclerosis, where the hardening is happening inside a blood vessel, and it's because of diet and cholesterol.
All right.
So you can see why the visual categorization is a massive flaw.
Okay, so if the tissue gets patched with this thick, hard scar tissue, or if it calcifies, it's going to take up more physical space than healthy tissue would.
Inherently, yes.
And if that happens inside a tube, like a blood vessel, it leads directly to our third root, steno.
Right. Steno comes from stenos, meaning narrow or constricted.
Okay.
It describes an abnormal narrowing of any tube, opening, or passage in the body. This could be a vital heart valve, a major artery, the spinal canal, or even a bile duct.
Basically any plumbing in the body.
Any plumbing at all. Something is physically encroaching on the space, restricting the flow of whatever normally passes through it, whether that's oxygenated blood, food, air, or cerebrospinal fluid.
Now, looking at the clinical data in the sources, I feel like we really need to clarify the difference between stenosis and a total occlusion.
Oh, definitely.
Because people use those terms interchangeably all the time, and biologically they are worlds apart.
They are completely different situations.
So to move away from generic traffic metaphors, stenosis isn't just a slow highway. Think of an old calcifying plumbing pipe in a really historic house.
Okay, yeah.
Over decades, mineral deposits build up on the inside of the pipe. The passageway gets narrower and narrower.
So the water pressure drops?
Right, it drops to a trickle. It takes forever to fill a glass of water, this is the key, water is technically still getting through.
And that distinction dictates the entire medical response.
Right.
What you just described with a narrowed pipe is stenosis.
Right.
A complete blockage where the pipe is entirely severed or a massive clot completely plugs that remaining tiny hole, that is an occlusion.
So a doctor is looking at those two scenarios with totally different levels of panic.
Oh, vastly different. I mean, a 90% stenosis in a coronary artery is a ticking time bomb, for sure.
That sounds bad.
It is, and it causes severe chest pain called angina, but there is still a trickle of blood keeping the heart muscle alive downstream.
Okay, but 100% occlusion.
100% occlusion means the blood supply is completely instantaneously severed. The tissue is actively suffocating.
Wow.
The medical urgency, the surgical tools required, the timeline for permanent brain or heart damage. Literally everything shifts the moment a stenosis converts into an occlusion.
Okay, let's take a step back for a second. If words like sclerosis are clunky, and they rely on superficial visual traits, and they mislead people about underlying mechanisms,
Yeah.
why hasn't modern medicine updated the vocabulary? Why are we still using these ancient Greek adjectives for 21st century diagnostics?
Well, because the vocabulary of medicine wasn't invented by a committee in a modern genetics lab, you know?
Fair point.
These roots are artifacts of history. Hippocrates, practicing in the 5th century BCE, used forms of necros simply to describe the dark, dying tissue he saw in battlefield wounds.
You're just calling it like he saw it.
Exactly. And Galen, hundreds of years later in the Roman Empire, he used scleros-based words when describing hardened organs he found during animal dissections.
Right.
They didn't coin these terms as rigid diagnostic codes. They were just speaking their native language to describe what was right in front of them.
Here's where it gets really interesting, though, because they didn't stay casual adjectives.
No, they didn't.
We flash forward to the 18th and 19th centuries, and European medicine undergoes this massive revolution. Pathologists start systematically mapping out diseases, and they're doing it primarily by cutting people open on the autopsy table.
That is the era of the great disease classification boom. Medicine was transitioning from philosophy to observable anatomy.
Right.
Let's look at how the definition of necrosis evolved during this time. In 1858, a brilliant German pathologist named Rudolf Virchow published a landmark, earth-shattering book called Cellular Pathology.
I remember this from the notes, because before Virchow, the dominant medical paradigm was the humoral theory.
Yes, the humors.
The idea, going all the way back to the ancients, that human health was dictated by an imbalance of 4 mysterious bodily fluids: blood, phlegm, yellow bile, and black bile.
Yeah, exactly. If you were sick, your fluids were just out of alignment.
But Virchow rejected that entirely.
He threw it right out. By utilizing improved microscopes, he proved that disease does not originate from a vague imbalance of mystical fluids. It originates at the level of the individual cell.
Hence his famous Latin phrase, omnis cellula cellula.
Every cell stems from another cell, yes.
Wow.
And because of that breakthrough, Virchow sharpened the definition of necrosis. It was no longer a vague corruption or putrefaction of the body like they used to think.
It became specific.
It became a specific, observable, mechanical death of individual cells breaking down.
And around the same time, we see the naming of multiple sclerosis, which you mentioned earlier.
We do.
In 1868, this renowned French neurologist, Jean-Martin Charcot, is working at the massive Salpêtrière Hospital in Paris.
A very famous hospital.
Yeah. And he's examining patients suffering from this mysterious progressive paralysis. When those patients pass away, he performs autopsies and finds these strange, hardened, scar-like patches scattered throughout their brains and spinal cords.
Right. And Charcot was the one who realized that the fatty myelin insulation had been destroyed and the body had laid down that firm scar tissue in its place.
So he named it based on what it looked like.
Yes. He termed it sclerose en plaques, which literally means hardening in patches.
Yeah.
Before Charcot's autopsies, these paralysis cases were just muddled together as general neurological weakness.
He used the physical evidence of hardening to unify and define the diagnosis for the very first time.
Exactly.
But looking at the sources, the evolution of how we talk about artery disease is probably the most directly relevant to you, the listener, and your everyday health.
Oh, without a doubt. So in 1833, a French physician named Jean Lobstein was examining the thickened, stiff artery walls of cadavers.
Okay.
He needed a term for this phenomenon, so he coined the generic word arteriosclerosis. He was essentially just translating hardened arteries into medical Greek.
But the real breakthrough came decades later, right? In 1904.
Right. A German pathologist named Felix Marchand looked closer and realized that Lobstein's umbrella term was obscuring a critical detail.
Because Marchand realized that not all hard arteries are the same.
No, they aren't.
Some are just stiff from age, but others have something much more sinister hiding inside them.
Marchand noticed a specific type of hardening that wasn't solid all the way through. It had a soft, mushy, fatty core hidden inside a hard outer fibrous cap.
Gross.
Yeah, a bit gross. So he went back to the Greek dictionary. He took the word ather, which translates to gruel or porridge.
Which perfectly describes that nasty, fatty, cholesterol-rich core.
Exactly. And he fused it with sclerosis, the hard cap. He coined the term atherosclerosis.
And why does Marchand being so pedantic about finding the gruel actually matter to the listener today? Like, why should we care?
Because splitting those terms changed the entire trajectory of preventative medicine.
Really? How so?
Well, if a patient has generic age-related hardening of the arteries, arteriosclerosis, there isn't a tremendous amount a doctor can do to reverse the clock.
It's just getting older.
Right. But fatty plaque disease atherosclerosis, the gruel that is driven by behavior and biology. It responds to changes in diet, exercise, and crucially, modern lipid-lowering drugs like statins.
Oh, wow.
Identifying the specific chemical mechanism hiding underneath the physical hardness paved the way for modern cardiology.
Which brings us perfectly to how these three roots operate inside your body in real time.
Let's do it.
We've defined them, we know their history, we know the difference between the gruel and the scar tissue. Now let's look at the deadly pipeline. How do athero, sclero, steno, and necro chain together to cause a massive cardiovascular event?
Think of it as a tragic domino effect driven by the body trying and failing to heal itself.
Okay.
It starts with the gruel. Over years, fatty deposits and LDL cholesterol build up inside the inner lining of an artery wall. Your immune system senses this buildup as damage, like a microscopic wound.
But tries to fix it.
It tries. It sends white blood cells to eat the cholesterol, but they gorge themselves, die, and create a highly toxic lipid pool.
Yikes.
Yeah. The body panics and tries to wall off this toxic spill by hardening it with a thick, fibrous scar tissue cap. That is the sclerosis.
It's trying to heal the injury by burying it, but it's inadvertently building a time bomb.
Yes, exactly. And as that hardened, gruel-filled plaque continues to grow, it has nowhere to go but inward.
Right, into the tube.
It begins to protrude into the center of the blood vessel. It physically narrows the passageway. Now we have stenosis.
The plumbing pipe is getting
The
clogged.
plumbing is clogged, blood flow is reduced.
And what's the final fatal domino? The transition to necrosis.
The fibrous cap is constantly under pressure from the blood pumping past it. If that hardened cap cracks or ruptures, the highly toxic gruel is instantly exposed to the bloodstream.
Oh no.
The body's immediate reaction to this is to form a massive blood clot to seal the rupture. In a matter of minutes, that clot can grow so large that it completely blocks the narrowed vessel, turning our stenosis into an occlusion.
And the blood just stops.
It stops. The tissue downstream that desperately relies on that oxygen-rich blood begins to starve. If the blockage isn't cleared by emergency surgery or clot-busting drugs within hours, that tissue dies permanently.
That is necrosis.
That's necrosis. When this exact pipeline happens in the coronary arteries feeding the heart muscle, it's a myocardial infarction, a heart attack. When it happens in the carotid arteries feeding the brain, it's an ischemic stroke.
It's honestly terrifying how mechanically straightforward it is.
It really is.
But digging into the sources, I have to ask,
Huh?
do these three always have to happen together? Like, do you need a fatty plaque and a slow narrowing to eventually get necrosis?
Not at all. The source material highlights that these mechanisms can operate completely independently of one another. Let's look at necrosis happening all by itself, driven by pure physical trauma.
The perfect example of this in the notes is from the world of professional sports.
Oh, yeah.
The legendary NFL running back Bo Jackson. In a 1991 playoff game, he was tackled and suffered a severe hip dislocation.
It was a devastating high-impact injury.
Yeah.
That immense physical trauma literally popped the ball out of the socket, and in doing so, it instantly stretched and tore the delicate blood vessels that supply oxygen to the head of the femur bone.
So there was no cholesterol plaque. There was no slow hardening over decades. The blood supply was just violently severed in a fraction of a second.
And because the blood supply was severed, the bone cells, the osteocytes inside his hip, literally starved to death.
Wow.
This is clinically known as a vascular necrosis. Dead bone tissue cannot regenerate or support immense mechanical weight of a professional athlete.
Right, it would just crumble.
It did. The structural integrity of the joint surface essentially collapsed, permanently ending his football career and requiring a total hip replacement.
That is wild.
It was pure, unadulterated necrosis with zero sclerosis or stenosis involved.
We also see extreme examples of isolated necrosis in the historical notes.
Yes, going back in time a bit.
During Napoleon's catastrophic retreat from Russia in 1812, his legendary chief surgeon, Dominique Jean Larrey, was dealing with horrifying amounts of necrotic tissue on the battlefield.
The frostbite was unimaginable.
Thousands of soldiers were losing fingers, toes, and entire limbs to it. The extreme sub-zero cold caused the blood vessels in their extremities to constrict so violently that the tissue simply froze and died of oxygen starvation.
No plaque needed.
Exactly. Larry had to perform emergency amputations on a massive scale in freezing conditions just to physically remove the necrotic tissue before gangrenous infections could spread into the bloodstream and kill the men.
It highlights just how visceral and deeply historical the reality of necro really is. But we can also look at stenosis occurring completely in isolation, without any dying tissue or cholesterol plaques.
Yes, The notes highlight this fascinating congenital condition, meaning something a patient is born with.
Right.
In 1888, the Danish pediatrician Harold Hirschsprung clearly described infantile pyloric stenosis. This affects roughly 1 in 500 to 1,000 live births.
It's fairly common.
Yeah. In the first few weeks of a baby's life, the pylorus, which is the small muscular valve at the bottom outlet of the stomach, simply begins to thicken and grow abnormally large.
It just hypertrophies. There's no plaque, no dead tissue, no frostbite.
It's like a drawstring on a bag that has been pulled so incredibly tight that the knot is permanently jammed.
Nothing can get through.
Nothing. The hallmark symptom is that the baby begins forceful projectile vomiting because the breast milk or formula simply cannot get past the narrowing to enter the small intestine.
It is pure mechanical stenosis.
And thankfully, it is completely cured by a very simple, incredibly common pediatric surgery to just snip and loosen that overgrown muscle.
So we have these highly distinct, well-established mechanical definitions.
Right.
But as we move from the 19th century battlefields and autopsy tables into 21st century molecular labs, we are finding that the old Greek definitions are starting to crack under modern scrutiny.
The binaries aren't as neat as we thought.
Not at all.
Let's talk about the biggest upheaval in the research you provided. Because for the longest time, biology textbooks taught a very strict dichotomy about cell death.
They did.
On one side, you had necrosis. It was seen as messy, accidental, traumatic death. You freeze a finger, you tear the blood vessels in a hip. It's violent trauma.
The cell swells, bursts, and causes a massive inflammatory mess.
Right. But on the other side, the body has this totally different process called apoptosis.
Right, apoptosis.
Which is the neat, orderly, genetically programmed suicide of a cell when it is simply old or no longer needed. The cell quietly shrinks and gets recycled without sounding any alarms.
That was gospel for decades. Apoptosis was the clean, quiet, cellular suicide, and necrosis was the sloppy, unregulated murder.
But starting around 2005, researchers, most notably Juning Yuan's lab at Harvard, completely destroyed that binary.
They turned it on its head.
I was reading this part of the notes and trying to piece it together. They found a type of cell death that looks exactly like messy, accidental necrosis under a microscope.
Right, the swelling, the bursting.
The huge inflammatory mess. But it isn't accidental at all. It is actively orchestrated by the cell's own internal genetic machinery.
They named this phenomenon necroptosis.
But my immediate thought was, why on earth would a cell choose to die a messy, explosive death on purpose? Like, why not just use the clean apoptosis method?
Because sometimes dying quietly is incredibly dangerous for the rest of the organism.
Oh, interesting.
Imagine a cell realizes it has been infected by a highly replicating virus, or it detects its own DNA mutating into a malignant cancer cell.
Okay.
If it uses apoptosis and quietly shrinks away, the virus might survive the process and infect the neighbor. Or the immune system might not notice the cancerous mutation until it's way too late.
So by intentionally triggering a messy, explosive death, the cell is essentially pulling the fire alarm on its way out.
That is exactly how it works mechanically. The cell uses very specific detonator proteins known as RIPK1 and RIPK3.
Detonator proteins?
Yeah. And instead of quietly dismantling the cell from the inside, these proteins intentionally puncture the cell's outer membrane. They literally blow the doors off. This spills all the internal alarm chemicals and inflammatory cytokines directly into the surrounding tissue, guaranteeing that the body's immune system, the white blood cells, wake up, rush to the scene, and attack whatever threat caused the cell to sacrifice itself.
That completely flips the script. The old Greek root for a passive corpse is now a dynamic, cutting-edge weapon in medical research.
It really is.
Because if scientists can figure out how to artificially force tumor cells to undergo necroptosis, they can ring the alarm bell and trick the patient's own immune system into attacking the cancer.
If we connect this to the bigger clinical picture, modern science isn't just redefining the biology of these words, it's radically changing how we use them to make surgical decisions.
Oh, for sure.
As medicine advanced, these descriptive words were turned into hard mathematical numbers, and that created entirely new dangers.
This brings us to the stenosis threshold debate in the source material. It's the classic trap of treating the spreadsheet instead of the patient.
Yes. So in 1991, a landmark study called the NASCET trial was published. Right. It looked at patients who had already suffered terrible symptoms like mini strokes from narrowed carotid arteries in their necks.
Okay.
The trial proved mathematically that if a symptomatic patient had a 70% or greater stenosis in that artery, they benefited significantly from a major surgery called an endarterectomy.
Where a surgeon physically opens the artery and scrapes out the plaque.
Exactly.
But the danger was how the medical community interpreted that data.
They took it too literally.
Doctors saw that 70% stenosis was the magic scientifically validated number for surgery. So they stopped asking if the patient actually felt sick and just started cutting based on the math.
The 70% cutoff became a rigid, inflexible rule of thumb. Surgeons started operating on patients who happened to have a 70% narrowing found on a routine ultrasound, but who hadn't actually experienced a single symptom yet.
And later clinical trials, like the ACAS study, had to aggressively push back against this.
They had to step in. They proved that for asymptomatic patients, the risks of stroke from the surgery itself almost outweighed the marginal preventative benefits.
So people were undergoing a major neck surgery, risking nerve damage and stroke, all because a Greek adjective describing a narrowing pipe had been translated into a statistical trap on a chart.
It's a perfect example of a diagnostic threshold taking on a life of its own, far beyond what the original biological evidence justified. You cannot treat a percentage. You have to treat the complex human being.
And looking at the final notes, it isn't just researchers and surgeons debating the terminology. Patients are actively pushing back too.
Yes.
Take the disease scleroderma.
Well, based on our roots, it translates literally to hard skin.
Right, but patients and specialized clinicians actively dislike using that term publicly because it completely undersells the lethal reality of the condition.
It sounds like just a rash.
Exactly.
Yeah.
But scleroderma isn't just a cosmetic dermatological issue. It is systemic sclerosis. It involves a massive overproduction of collagen that doesn't just affect the skin, it fatally hardens the connective tissues inside the lungs, the heart, and the kidneys. The ancient Greek root accurately describes the most visible symptom to the naked eye, the hard skin, but it masks the lethal danger hiding deep inside the body.
So what does this all mean for us today?
Yeah.
We've traced these 3 mechanical failures from the ancient texts of Hippocrates cutting away dead tissue, to Charcot mapping nerve scars in Paris, all the way to modern cutting-edge, minimally invasive surgeries.
It's an incredible journey.
It is. Today, an aging patient with a stenotic, calcified aortic heart valve doesn't even need open heart surgery. A doctor can perform a TAVR procedure, transcatheter aortic valve replacement, where they thread a collapsible replacement valve through a tiny incision in the leg.
You just push it up there.
They push it all the way up into the heart and expand it, literally crushing the old, stiff, sclerotic valve out of the way to restore blood flow.
So the technology has evolved from primitive iron scalpels and humeral theory to genetic detonator proteins and transcatheter valve replacements.
But the underlying mechanical reality hasn't changed a bit. Death, hardening, and narrowing. These 3 ancient Greek roots prove that while our medical tools become miraculously advanced, the physical ways the human body breaks down remain remarkably, stubbornly consistent.
Which brings us to a final mind-bending linguistic twist I want to leave you with. Something hiding right there in the etymology notes you provided.
This is my favorite part.
The next time you are sitting in a courtroom or reading a fantasy novel, or honestly just looking in the mirror, remember that these clinical horrors are hiding in plain sight in our everyday language.
Yep.
Think about that courtroom stenographer rapidly taking down the trial transcript on their little machine. They're practicing shorthand. In Greek, stenosgraphing, literally, narrow writing.
Narrow writing.
They're using the exact same root, practicing the exact same concept of narrowing down a passage of text as the stenos choked off artery in a cardiology ward.
It's wild to think about.
And if you open a fantasy novel and read about a dark necromancer raising an army of the undead, they share the exact same necros root, the business of corpses and death, as the necrotic gallbladder sitting in a pathology lab.
Still just meaning dead.
Finally, walk into your bathroom and look closely in the mirror. Look at the whites of your eyes. You are looking at your sclera.
Your sclera.
It was named by ancient anatomists who realized it was the tough, fibrous, protective outer coat of the eye, acting in contrast to the soft, delicate cornea. You are looking right at the hard root of sclerosis.
It's all connected.
So thank you for sharing these incredible notes with us and joining us on this deep dive into the source material. Keep questioning the words that define our world, because you never know what ancient biological mechanics are hiding in your own vocabulary. We'll catch you next time.